So now DIC. So DIC commonly occurs in settings of sepsis and is characterized by widespread activation of the coagulation cascade with formation of microthrombi. Lab results reveal prolonged PT-APTT, thrombocytopenia, and low fibrinogen, that is a consumptive coagulopathy. And patients usually have symptoms of bleeding oozing from venopuncture sites. So this is a very commonly understood fact, and I don't think I need to explain it further. So enzyme deficiencies of the early steps in porphyrin synthesis causes neuropsychiatric manifestations without photosensitivity, whereas late step derangements leads to photosensitivity. So okay, so in the porphyrin synthesis, if there is a defect or deficiency of enzymes early in the steps of porphyrin synthesis, then it causes some neuropsychiatric manifestations along with without photosensitivity, whereas late steps derangements lead to photosensitivity manifestations as vesicles and blisters formation on soil and exposed areas, as well as edema, pruritus, pain, and erythema. So photosensitivity, the common symptoms of photosensitivity like vesicles, edema, pruritus, pain, and erythema. So all of them appear when there are some late steps defect in enzymes, whereas early on defects lead to neuropsychiatric manifestations without photosensitivity. Okay, AIP, acute intermittent porphyria attacks are due to accumulation of ALA and PBZ, porphobilinogen and alpha libulinic acid. So aminolibulinic acid. So okay, AIP, acute intermittent porphyria. So acutely but intermittent porphyria are due to accumulation of ALA and PBZ, resulting from inherited PBZ deaminase deficiency. So porphobilinogen deaminase. So deaminase and removal of amine group is the enzyme that PBZ deaminase does. So this deficiency leads to acute intermittent porphyria combination with ALA synthase induction. So there is induction of ALA synthase. So a more ALA forms. So accumulation of ALA as well as deficiency accumulation of ALA as well as PBZ results in the formation of acute intermittent porphyria. But it occurs from due to inherited PBZ deaminase deficiency along with ALA synthase induction, typically due to certain treatment or drugs, alcohol use, or a low calorie diet, management with glucose, or let's say 10% dextrose or hemin inhibitors, ALS in this activity. So hemin, so to treat acute intermittent porphyria, so glucose is given, 10% dextrose can be given, or hemin inhibitors are generally used, which inhibits hemin, which inhibits ALA synthase. Induction of ALA synthase has resulted in the formation of porphyrins or PBZ accumulation or ALA accumulation. So ALA accumulation can be inhibited by giving hemin inhibitors. Okay. Acute intermittent porphyria. Next point is acute intermittent porphyria is an autosomal dominant. So porphyria is a dominant condition, autosomal dominant condition caused by porphobilinogen deaminase deficiency. As I said earlier, at the same point, most patients remain asymptomatic, but a minority patients with acute attack are characterized by abdominal pain and vomiting. So abdominal pain occurs, vomiting occurs, neuropathy occurs, neuropsychiatric signs and symptoms occur, and reddish brown urine occur. Treatment consists of IV glucose or dextrose or heme preparations which downregulate ALA synthase activity. So when glucose is given, or let's say when heme preparations are given, then it decreases the activity of ALA synthase, thus decreasing the amount of ALA, which is one of the causes or component of AIP. So the initial attachment of the virial envelope or capsid surface proteins to the complementary host cell surface receptor is essential to viral tropism for specific tissues and invasion of cells. The initial attachment of the virial envelope or capsid surface proteins to the complementary host cell surface. So cell surface receptors of the host bind to viral envelope or capsid surface proteins So it is the cause of viral tropism of specific tissues and meson of cells. Many viruses bind to normal host cell plasma membrane receptors to enter host cells. Non-host cell receptor and variant protein binding specificities include CD4 with SIB-GP120. So SIB-GP20 binds with CD4. CD21 binds with Epstein-Barr virus GP350. So CD4 and GP120 are together. So GP350 and CD21, GP350, CD21, GP350, CD21, GP350 of host cells, cell surface membrane, and CD21, and erythrocyte P antigen with parvovirus B19. So parvovirus B19 and RBC's P antigen on the surface bind together. So this is the cause of viral tropism. Okay, PSO. Psoriasis refers. Sorry. P partial pressure of oxygen. So what does it mean? So PSO. So what is PSO? So PSO refers to the partial pressure of oxygen at which hemoglobin is 50% saturated. So it's in the middle of the sigmoid sept curve. So there is partial pressure of oxygen where 50% of oxygen is saturated. Hemoglobins with high oxygen affinity have a decreased P50 that is represented by a leftward shift of oxygen dissociation curve. So P50 is something that is in the base or in the x-axis of the oxygen hemoglobin concentration curve, and the saturation is in the y-axis. So decreased P50 or left shift causes decrement in P50, whereas right shift causes increased P50. So this reduced ability to release oxygen with the peripheral tissues leads to renal hypoxia, increased EPO synthesis, and compensatory erythrocytosis. Okay, it is understandable. A left shift of oxygen hemoglobin indicates high oxygen hemoglobin oxygen affinity and can be caused by increased pH, decreased 2,3 bpz, or decreased temperature. Leftward shifts of the curve inhibit the release of oxygen within peripheral tissues. Understandable again. 2,3 bpz normally forms ionic bond with the beta subunits of deoxyhemoglobin SBA. 2,3 bpz. One of the most important steps in glycolysis is the formation of 2,3 bpz, which normally forms ionic bond with the beta subunits of deoxyhemoglobin A. So deoxy form of the hemoglobin A molecule, the 2,3 bpz goes and attaches to the ionic bond with the beta subunit of deoxyhemoglobin A, facilitating oxygen release and peripheral tissues. So when 2,3 bpz is like a box. So boxing, blow. When it comes, it blows out oxygen into the peripheral tissues. Mutation that result in loss of 2,3 bpz binding pockets, positive charge, cause SBA to resemble SBF. So if there is mutation in SB 2,3 bpz pockets in SBA, so hemoglobin molecules with the pockets to ionically bind with ionically bind to 2,3 bpz, if defective, results in its resemblance to SBF hemoglobin, fetal hemoglobin, which binds to oxygen with higher affinity, so it cannot release oxygen in the peripheral tissues. The cytogenetic effect, the translocation 1570 is associated with acute promyelocytic leukemia. So acute promyelocytic leukemia has a common translocation 15,17. 15,17 is the cytogenetic defect. Translocation 15,17 is associated with APML, acute promyelocytic leukemia. AML, it's AML3. A translocation involving rare alpha gene, so retinoic acid receptor alpha gene from chromosome 17, and the PML gene on chromosome 15. So PML gene chromosome 15 leads to formation of PML rare alpha, a fusion gene. So PML rare alpha. So PML is present in chromosome number 15, and rare alpha, so retinoic acid receptor alpha, is present in chromosome 17. This fusion gene produces a product which inhibits differentiation of myeloblasts and triggers the development of APML. So it limits the differentiation of myeloblasts into further cytic or sites or cells, and results in APML. So APML is the M3 variant of acute myelogenous leukemia, AML. It affects adult patients and may precipitate DIC and may present with a DIC. D3, so M3 has 3 letters and DSC has 3 letters. So APML is a variant of APML is a variant of AML where DSC can occur. The 15 translocation 17, 15, 17 translocation is a common cytogenic abnormality that leads to the formation of PML, rare fusion gene, which is unable to signal proper cellular differences, unlike the normal RAR. Unlike the normal RAR, the presence of rod-shaped intracytoplasmic inclusions. So rod-shaped intracytoplasmic inclusions are called A-rods is characteristics of many forms of AML. The M3 variant of AML, APML, is associated with translocation 1517. Our rods are there, I think, eosinophilic rods, deformed azurophilic granules found in the cytoplasm of myeloblasts that stand positively for MPO. It stands positively for myeloperoxidase. So they stand positively for myeloperoxidase, and our rods are found in abundance in AML M3 type APML. So they are in abundance in M3 types. M3 type is one of the most important subtype of AML. The individual subunits of the hemoglobin molecules are structurally analogous to myoglobin. So the individual subunits of the hemoglobin molecules, alpha, beta. So the individual subunits of hemoglobin molecules are structurally analogous to myoglobin. So if separated, it behaves like a myoglobin. So the monomeric subunits of will demonstrate a hyperbolic oxygen dissociation curve similar to that of myoglobin molecule. Nitrites are oxygen agents. Nitrites are oxygen agents that are effective in treating. So nitrites are used in treatment of cyanide poisoning due to their ability to induce hemoglobin, methemoglobinemia. Hemoglobin M. So methemoglobin contains oxidized state of iron, that is Fe3 plus rather than Fe2 plus, and cyanide bind to Fe3 plus more avidly than to the mitochondrial cytochrome enzymes, diminishing the cyanide's toxic effect. So nitrites. So nitrites can be given in treatment of cyanide poisoning. So amyl nitrates are given in case of cyanide poisoning, because amyl nitrate forms methemoglobin, and methemoglobin contains Fe3 plus and not Fe2 plus, and those cyanides which generally impact oxidative phosphorylation by binding to the Fe2 plus state that is present in the mitochondria will now bind to methemoglobin, thus resulting in decrease in the cyanide's toxic effect. Methemoglobinemia can cause dusky discoloration of the skin, similar to cyanosis, and because methemoglobin is unable to carry oxygen, a state of functional anemia is induced. So anemia occurs because of absence of oxygen in tissues, peripheral tissues. So methemoglobin, although has oxygen, results in a relative anemic state. However, the blood partial pressure of oxygen will be unchanged, as it's a measure of oxygen dissolved in plasma and is unrelated to hemoglobin function. So the partial pressure of oxygen is not related to the function of hemoglobin. So the hemoglobin function does not comply, or hemoglobin function is unrelated to the partial pressure of oxygen. So partial pressure of oxygen means that part of oxygen is dissolved in the plasma itself. So therefore, methemoglobin, where the oxygen cannot be delivered to the peripheral tissues because of functional defect in hemoglobin molecule itself, does not change the value of blood partial pressure of oxygen. Now, GCPD deficiency is an X-linked disorder. So this deficiency is actually a recessive disorder of the hexose monophosphate PPP pathway, pentose phosphate pathway. So G6PD deficiency means HNP pathway is a pathway where there is oxidative and non-oxidative steps. Oxidative step is irreversible and non-oxidative step is reversible. Non-oxidative step is the one where pentose ribose 5-phosphate is formed and fructose 6-phosphate is formed, while they are formed. So they form an DPH, which helps in the reduced form of the glutathione, which helps in the formation of reduced form of glutathione. But in this very deficiency, there is a high oxidative stress, because that NADP is produced via and PPP is affected. In affected individuals, the amount of NADP produced in RBCs is low, which impairs glutathione-mediated inactivation of free radicals. Hemolytic episodes are induced by infections, treatment, and other oxidants. So, hemolytic episodes are induced by infections, treatment, and other oxidants. All right. So, next point is maturing erythrocyte RBCs lose the ability to synthesize heme when they lose their mitochondria, which is necessary for the first and final three steps of heme synthesis. So those RBCs which has to mature, so the RBCs which have to mature, they cannot synthesize heme. Maturing RBCs lose their ability to synthesize heme when they lose their mitochondria. So immature RBCs are mitochondria, so they can synthesize heme, but mature RBCs do not, and hence cannot synthesize heme. So heme synthesis. The mitochondria is essential in the first and final three steps of synthesis. Thus they cannot synthesize heme molecule. Synthesize heme. So heme oxygen converts heme to biliverdin. So heme is converted to biliverdin. Heme forms biliverdin by heme oxygenase. So heme oxygenase is the enzyme which converts heme to biliverdin, a pigment that causes greenish color to develop in bruises several days after an injury. So if there is a blood, so if there is let's say a contusion in the body, the contusion first has defect, has RBCs which disrupt and release hemoglobin. The heme component of it is then later converted to biliverdin, which gives a greenish hue to the bruise. It's because of conversion of heme to biliverdin via heme oxygenase. SBC is caused by a missense mutation that results in glutamic residue being substituted by lysine. So glutamic SBC. So SBS is results because of glutamate replaced by valine, but glutamate replaced by lysine results in defective beta globin chain and thus causing hemoglobin C, SBC disease. This results in over decreasing negative charge for the hemoglobin molecule. So glutamate is a negative charged compound, while lysine is neutral, and valine, which replaces glutamic acid in sickle cell disease, is relatively positively charged. And therefore, this results in overall decrement in negative charge of the hemoglobin molecule. The speed of hemoglobin movement during gel electrophoresis, hemoglobin electrophoresis, is SBS. So the fastest moving is hemoglobin A. Okay, so there is decreased negative charge, means hemoglobin is largely positive. So in the electrophoresis, the speed of the hemoglobin molecule is compared which of the hemoglobin molecule moves faster towards the positive charge. So hemoglobin A is more negative, so its speed is faster. SBS is neutral. So one part is neutral, so the negative charge is still retained in SBS. So I said I was mistaken. So lysine is actually positively charged, while valine is neutral. So SBS has second speeding property than SBC. Lysine. Okay, so lysine is a positively charged amino acid. This makes sense. Okay, exposure to ionizing radiation, including therapeutic and palliative radiation therapy, induces DNA damage through DNA double-stranded fractures and the formation of oxygen-free radicals. So when we are exposed to ionizing radiation during any therapeutic or palliative radiation therapy, palliative radiation therapy, it induces ionizing radiation, induces DNA damage by inducing DNA fractures. So DNA double-strand fractures and formation of oxygen-free radicals. So oxygen-free radicals are formed, and there's DNA fractures. in ionizing radiation. So in patients with anemia, and other chronic hemolytic disorders, the most common viral cause of aplastic crisis is infection of erythroid progenitor cell with parvovirus B19 or non-enveloped single-strand DNA virus. So sickle cell anemia and chronic hemolytic disorders, viral infection is most common viral infection is parvovirus B19, which affects the erythrocytic precursor cells in the bone marrow, and it is a non-enveloped, so it's not enveloped single-strand DNA virus. Now, let's talk carbon monoxide. So carbon monoxide binds to hemoglobin with much higher affinity than oxygen, thereby preventing oxygen binding to hemoglobin, reducing the unloading from hemoglobin in the tissues. Carbon monoxide poisoning increases carboxyhemoglobin concentration but doesn't affect the partial pressure of oxygen, because carboxyhemoglobin is binding to hemoglobin, and partial pressure of oxygen is not dependent on the hemoglobin at all. It is the dissolved hemoglobin in the dissolved oxygen in the plasma, and doesn't precipitate it does not precipitate methemoglobinemia. So it does not precipitate methemoglobinemia. Rather, methemoglobinemia is precipitated by the use of nitrite compounds, which release nitrite compounds. All right. So CML and LR have presentations similar to leukocytosis. So leukocyte reaction. So CML, chronic myeloid leukemia. So chronic myeloid leukemia, which is one of the commonest blood malignancies in the old age and adults and old age, and leukocyte reaction have presentation. Leukocyte reaction is also a kind of reaction where there is increased amount of WBC. So the leukocyte reaction can have presentations similar to leukocytosis. However, LAP lab level, so leukotriene alkaline phosphatase is level is normal or increase in leukocyte reaction but decrease in CML. So leukocyte reaction is a reaction, so there is higher amount of enzymatic activity. Thus LAP level, leukocyte alkaline phosphatase level is normal or increase in leukocyte reaction but not in CML. Definitive diagnosis of CML requires demonstration of Philadelphia chromosome transcription 922 or BCR-ABL fusion gene or mRNA. Alright, the findings of OURODS. OURODS are myeloperoxidase positive, linear purple-red inclusions with immature myeloid precursors. Linear, they are single-lined, purple-red, so they're eosinophilic inclusions with immature myeloid precursors. Is helpful in making the diagnosis of AML. So yeah, our AML's characteristic findings are in the presence of OURODS. OURODS are not found in ALL. In CML, there are more mature cells and fewer blasts. So in CML, chronic, so because it is chronic, there are more mature cells. CML, there are more mature cells and fewer blasts. Precursor B-cell ALL and pre-T cell ALL can be distinguished by immunophenotyping. So pre-B-ALL, pre-BAL, and pre-TAL can be distinguished by immunophenotyping. The lymphoblastin precursor pre-BAL are TDT positive. So something related to thymidylate synthase or something. So pre-BAL is TDT positive, CD10 positive, CD19 positive. So pre-BAL are TDT positive. So it is B, therefore it is TDT positive, and so because it is ALL, so TDT is positive, and TDT is positive, and CD10 and 19 are more specific towards B cells, whereas lymphoblast and precursor T cells, so pre-TT, pre-TAL. So in pre-TAL, T cell markers, let's see the lower CD counts like CD2, 3, 4, 5, 7, 8. So T cell markers are CD2, 3, 4, 5, 7, 8. TDT because it is ALL, and CD1A is also positive in pre-TAL. So nasopharyngeal carcinoma. So nasopharyngeal carcinoma (NPC) is endemic in southern China. NPC, nasopharyngeal carcinoma, is endemic. So it is a very common finding in southern China due there is genetic and dietary factors that promote nasopharyngeal epithelial pre-malignant lesions. So nasopharyngeal pre-epithelial, the epithelium of the nasopharynx is the pre-malignant lesions is affected by dietary and genetic factors, which is most common in southern China. In almost all cases, malignant transformation occurs due to infection of pre-malignant cells. In almost all cases, EBV infects the epithelium of the nasopharyngeal epithelium, and subsequent expression of oncogenic viral proteins. So it releases some proteins like E1, 2, or something, I forgot, but they are oncogenic in nature, and therefore leads to nasopharyngeal carcinoma. The underlying biochemical feature of megaloblastosis is a defect in DNA synthesis. So DNA synthesis is the core cause of megaloblastic anemia. So because there is maturation of the cytoplasm but not of the nucleus, because nucleus has DNA and DNA is not mature. Because of lack of vitamin B12 deficiency in chronic alcoholics, some megaloblastic macrocytic anemia can result from a nutritional deficiency of B12 or folate, which impairs synthesis of purine and pyrimidine bases. So folate leads to lack of DTT and DUMP to DTTP. So something related to thymidine is not formed, which is essential for DNA synthesis. So folate is also so this is defective synthesis of purine and pyrimidine bases. Thus, there is discrepant differentiation of nucleus and cytoplasm. Okay, the CGs of TB are almost surrounded by large epithelial macrophages. The chronic granulose. I don't know what the meaning of CGs of TB. Let's go to the next. ChatGPT and ask simplify this. All right, it's doing its job. I think it's doing its job properly. All right, the CGs. CGs of TB are almost always surrounded by large epithelial macrophages with pale plain granular cytoplasm. So the I think CGs means something related to granulocytic large. Macrophages. So macrophages, let me search it on my phone. Multinuclear giant cells. Okay, the CGs means cytoplasmic granules. No, it's not cytoplasmic granules. CGs. What's the meaning of it? I'm not sure. TB almost run by large. I think the characteristic granules of TB are almost always cages necrosis. No, of TB. TB is TB. So TB almost surrounded by large epithelial macrophages. So large epithelial macrophages surround pale pink granular cytoplasm. The CD14 is a surface marker receptor to the monocyte macrophage cell lineage. So monocyte macrophage cell lineage has CD14. CD14 is present in monocyte macrophage cell lineage. All right. Trisomy 21 Down syndrome is detectable by cytogenetic karyotypic analysis and is the most common genetic cause of congenital intellectual disability. Cytogenetic karyotypic analysis can be done to diagnose Down syndrome. And the patient with Down syndrome are increased risk of developing ALL, so acute lymphoblastic leukemia and acute M7, acute megakaryoblast leukemia. So leukemia, acute megakaryoblast AML. Out of AML, M7 is the most common and ALL is very common. The presence of raised Steinberg cells on lymph node biopsy is diagnosis of classic Hodgkin's lymphoma. And raised Steinberg cells have abundant cytoplasm. So raised Steinberg cells, they are owl cells. Abundant cytoplasm, bilobed or double nuclei. So double nuclei and inclusion like eosinophilic nucleoli. So there is eosinophilic nucleoli, bilobed nucleus, which look like owl's eye. All right, follicular lymphoma is characterized by aggregates of packed follicles. So it is a follicle lymphoma of the follicles. So there are packed follicles. Packed follicles are present that obscure normal lymph node architecture. So lymph nodes have zonal centers, there are zonal matrix, there's cortex, there's medulla, there's a transitional zone, and in follicular lymphoma, the follicles are very, packed. Lymph nodes are very highly packed with follicles, and it even disrupts the normal lymph node architecture. 90% of the patients with follicular lymphoma have from follicular lymphoma follicular. So it starts with follicular. So it has translocation 14-18 translocation, which causes overexpression of the anti-apoptotic BCL2 protein. So BCL2 protein prevents apoptosis. I think it's present in the inner surface of mitochondria, and when inner surface of mitochondria is disrupted, and then BCL2 is leaked out and activates caspases. So and results in apoptosis. So it is And anti-apoptotic means it escapes the cell death and thus results in cancer. So follicular lymphoma with translocation protein 18 translocation has anti-apoptotic BCL2 protein expression, thus preventing cell death and thus resulting in cancer. Rituximab is a monoclonal antibody CD20 antigen. Its introduction has improved the prognosis of some lymphomas. So rituximab is one of the most highlighting drugs. It is even used in some kidney-related disorders. Histologically, Burkitt's lymphoma has a starry sky appearance due to the presence of macrophages and apoptotic bodies. So the stars are macrophages and apoptotic bodies, and the lymphoma, the sky, is a sea of medium-sized lymphocytes. So lymphocytes are the sea, and macrophages and apoptotic bodies are the stars. So macrophages and apoptotic bodies are the stars. All right. The rates of mitosis and apoptosis in the cancerous tissues are high. Almost all cases of Burkitt's lymphoma are associated with translocation of the simic gene. Burkitt's lymphoma starts with B. After B, in the alphabets, there's C. So C, MYC gene on chromosome number 8. So MYC, simic, C. You can make a C out of the 8. So all right. So C. So this there is. Okay, there's in Burkitt's lymphoma there's simic translocation. Simic translocation of chromosome is 8, usually to the IG heavy chain region, IGH region of chromosome number 14. So 8-14 translocation equals Burkitt's lymphoma. So 8-14 translocation simic in chromosome 8 moves to 14th chromosome, which has immunoglobulin heavy chain molecule SGH, and thus resulting in overexpression of simic gene, which is an oncogene again. EBV, Epstein-Barr virus genome is immunodeficiency. So I did okay. EBV genome is identified in approximately 50% of systemic B-cell lymphoma and almost all primary CNS lymphoma. So Epstein-Barr virus is one of the very common viruses. Epstein-Barr virus is one of the very commonly implicated viruses in cancers. And 50% of systemic B-cell lymphomas, 50% of systemic B-cell lymphomas, and almost all of primary CNS lymphoma occur in setting of HIV infection. So there is HIV infection and co-infection with EBV occur, and a high mitotic index is typical of Burkitt lymphoma. If there is high mitotic index, high mitotic index equals to Burkitt's lymphoma, and EBV genome is identified in approximately 50% of systemic B-cell lymphoma and almost all primary CNS lymphoma occurring in setting of HIV infection. And yeah, okay. Most of the cutaneous lymph from the umbilicus down. Most of the cutaneous lymph nodes from the umbilicus down into the anus below the dentate line drains to the superficial inguinal lymph node. So the cutaneous lymph node from below the umbilicus entering the anus below the dentate line drains to superficial inguinal lymph nodes. All right, exceptions are glans penis, and posterior calf. So glans penis is touching the calf, so posterior part of the calf. So exceptions are glans penis and posterior calf, which drains to deep inguinal nodes. So glans penis and posterior surface of the calf drains to deep inguinal nodes, while the part of anus below the dentate line, the ectodermal part of the anus, drains to superficial inguinal lymph node. All right, citrate anticoagulants in high volume blood transfusion can chelate plasma calcium. So citrate anticoagulants in high volume blood transfusion. If there is high volume blood transfusion and if citrate is aided, it can chelate plasma calcium leading to deficiency of calcium. That is, it binds to calcium and forms calcium citrate, thus resulting in decreased amount of calcium in the transfused blood, which causes peripheral neuromuscular excitability, paresthesia, muscle spasm, paresthesia, muscle spasms occur. So paresthesia, muscle spasms occur. That is most common with very rapid transfusion rates. This is most common with very rapid transfusion rates, but it can also be seen at low rates in patients with hepatic insufficiency because citrate is metabolized by the liver. Okay, so if citrate is not metabolized by the liver because of hepatic insufficiency, citrate level is raised, so it chelates with calcium, thus resulting in decreased calcium and thus peripheral neuromuscular excitability, resulting in paresthesia, muscle spasm, etc. So very rapid transfusion rates is transfusion is not commonly done. Okay, IgG consists of anti-IgG entity antibodies, so that opsonize Rh plus positive erythrocytes in the maternal plasma, promoting clearance by maternal Rh macrophages and preventing maternal Rh sensitization. It's routinely administered to Rh negative women at 28 weeks of gestation and immediately postpartum. So, so see, so the baby is positive. The positive part of the baby goes to the mother. So mother has to form antibody, if but anti-IgG when given to the mother at 28 weeks of gestation fights against those RBCs, tags those RBCs, and maternal spleen with macrophages breaks down those RS positive RBCs, and the mother's body thinks that there is no any foreign antigen like the RS positive antigen in its body, so it cleans out all the antibody formation and in the mother. All right, so I'm sorry for being very too vague at times. Now, the retinoblastoma tumor suppressor gene encodes the RB protein, which regulates the cell cycle. Okay, retinoblastoma is a tumor suppressor gene, which regulates the cell cycle. Active hypophosphorylated RB protein prevents damaged cells from proceeding past the G1 to S checkpoint. So, after G1 cell cycle, there is a G1 checkpoint. So, to cross that checkpoint to S synthetic DNA synthesis phase, one need to have active RB protein. So okay, so if there is active RB protein prevents defective cells to cross that G1 checkpoint. But if that RB protein is inactive, so if there is mutated, RB protein is mutated, then it can cross the G1 checkpoint. So active RB protein needs to be activated, means the phosphorus group from that RB protein needs to be removed or clipped off to for its effective function that acts as a G1 checkpoint. But if there is more phosphorylation of the RB protein, then it is inactivated. Thus, G1 checkpoint can be crossed very easily. While the inactive hyperphosphorylated RB protein allows the damage cell to enter mitosis, abnormal phosphorylation of the RB protein results in its inactivation. All right, understood. Proliferation signals. Proliferation signals activate CDK4. CDK, it is a kinase form, so proliferation signals activate CDK4, resulting in hyperphosphorylation of the RB protein. So hyperphosphorylated RB, so retinoblastoma protein, if it is hyperphosphorylated, it becomes inactive, so G1 checkpoint can be crossed easily. Cells are allowed to transition unchecked from G1 phase to the S phase in the cell cycle. Alright, so hyperphosphorylation can occur because of some kinase activity. So proliferation signals activity, so kinase activity means CDK4 is a kinase inducing gene. Alright, patients with SIV have much higher rates of lymphoma than general population. Many cases are due to underlying EBV infection. As I said earlier, EBV infection is most commonly implicated together with SIV, and EBV syndrome is highly seen in those lymphoma cases. Benign lymph node enlargement in response to antigen stimulation is associated with the polyclonal proliferation of lymphocytes. So benign lymph node enlargement, benign lymph node enlargement in response to antigen stimulation is associated with polyclonal proliferation of lymphocytes. On monoclonal lymphocytic proliferation is strong evidence of malignancy. Alright, so it's a difficult to understand, boys. So see, benign lymph node enlargement. So lymph nodes are enlarging because of antigen stimulation, for example, virus infection. So it causes benign enlargement of the lymph nodes. Okay, is associated with the polyclonal proliferation of lymphocytes. Okay, if antigen stimulus on lymph node, there is polyclonal, there is multiple multi-clonal or polyclonal proliferation of lymphocytes. So there is polyclonal proliferation of lymphocytes are proliferating inside the lymph node. They're resulting in lymph node enlargement. A monoclonal lymphocytic proliferation is strong evidence of malignancy. So okay, so there is infection, lymph nodes will be enlarged, but there is polyclonal proliferation of lymphocytes. But if there is monoclonal, only one cell lineage is dividing rapidly inside a lymph node, then it is a suspect for malignancy. Burkitt's lymphoma is characterized by rapid growth and a steady sky. Stars mean macrophages, and sky is a sea of lymphocytes. Microscopic appearance, translocation of simic oncogenes in the long arm chromosome 8 with the IgH region of chromosome 14 produces a nuclear phosphoprotein simic. Okay, nuclear phosphoprotein that functions as a transcriptional activator. So simic is a transcriptional activator. That was discussed before. So now next point, Epstein-Barr virus causes IM in teens and young adults. Okay, infectious mononucleosis in teens and young adults. It's also called Kissing's disease. Epstein-Barr virus causes infectious mononucleosis in teens and young adults. It's also associated with frequent malignant conditions, including Burkitt's lymphoma and nasopharyngeal carcinoma. So nasopharyngeal carcinoma is a well-known established etiology or result of Epstein-Barr virus, and Burkitt's lymphoma is also associated with Epstein-Barr virus. Burkitt's lymphoma, where there is translocation of 8-14 translocation, simultaneous activation, translocational activation. All right, overexpression of BCL2. If there is high BCL2 expression, leads to increased synthesis of BCL2 protein. So BCL2 lies inside the inner mitochondrial membrane. So in the inner mitochondrial membrane, there is BCL2. When the cell has to undergo apoptosis, the BCL2 is released. So if there is high amount of BCL2, then apoptosis is inhibited and promotes survival of the tumor cells. This overexpression of the protein occurs in follicular lymphoma, where there is 14-18 translocation, secondary to translocation of BCL2 oncogene from chromosome 18 to the IgH hemoglobin locus on chromosome number 14. So in follicular lymphoma, the 18th chromosome has BCL2 oncogene. This gets to IgH, hemoglobin heavy chain locus on chromosome number 14. So 18-14 translocation occurs, but it is written 14-18. Okay, BCL2 is anti-apoptotic, so it evades apoptosis. Now, next point, undifferentiated anaplastic tumors bear no resemblance to the tissues of origin. Anaplastic tumors, the cells in the anaplasia do not have resemblance to the tissue of origin. They are composed of pleomorphic cells with large hyperchromatic nuclei that grows in a disorganized fashion. Anaplastic tumors may also contain numerous abnormal mitotic and giant tumor cells. Okay, so they do not resemble their original tissue or at all. So they have hyperchromatic nuclei and abundant cytoplasm and increased NC ratio, so less cytoplasm and increased NC ratio, and have mitotic spindles or mitotic bodies and tumor cells inside the tumor. Okay, most tumor possess multiple cytogenetic abnormalities. Most tumors possess multiple cytogenetic abnormalities. Activation of POC results in stimulation of cellular proliferation. So activation of POC, cellular proliferation. So what is POC? I forgot. POC point of, I'm not sure. Okay, most tumor has cytogenetic abnormalities. Okay, then okay, let me ask internet. Proliferation on products of conception. I don't think it is a product of conception. To cell cycle. What's POC? It is product of conception. That's very difficult. So most people activation of POCs, product of conception, resulting in stimulation of cellular proliferation, inactivation of anti-oncogenes, eliminate oversight of the cell cycle. I think it stands for product of conception. Activation of product of conception results in stimulation of cellular proliferation. So cellular proliferation occurs. There's several signaling pathways like ERK inside the cell, and this activation or anti-oncogenes inactivation eliminates oversight of the cell cycle. Okay, so tumor suppressor genes are inactivated or cellular proliferation is uncontrolled, that is the death of cancer. So certain results in the same phenomena. Kaposi sarcoma typically presents as blue-violet or brownish skin plaques on the extremities and mucous membrane of HIV-positive patients. So if there is Kaposi sarcoma, there is blue-violet or brownish skin plaques on the extremities and mucous membrane. So blue, violet or brownish skin plaques in the extremities and mucous membrane. So in the mouth as well as in the fingers, in the HIV positive patients, there are bluish skin plaques or brownish skin plaques, means there is Kaposi sarcoma occurring. This tumor arises from primitive mesenchymal cells and is strongly associated with human herpes virus 8. Okay, so Kaposi sarcoma means muscle, so more muscle arises from mesenchymal cells, so primitive mesenchymal cells relates to Kaposi sarcoma and is associated with HSV8. So ER or PR positive in breast cancer indicates expected sensitivity to tamoxifen and aromatase inhibitor treatment. So ER positive means estrogen receptor positive, so there is a estrogen receptor in the cell. So something that destroys or decreases the amount of estrogen, like tamoxifen or aromatase inhibitors, can help in treatment of breast cancer. HER2 overexpression in breast cancer, so it's a more aggressive tumor that typically responds to treatment with anti-HER2 trastuzumab, anti-HER2 monoclonal antibody trastuzumab. It has a robust response. Okay, enoxaparin is a low enoxaparin. Enoxaparin is a low molecular weight heparin that functions like heparin in that it binds and activates antithrombin 3. So direct antithrombin 3. So it activates, and enoxaparin activates antithrombin 3. So enoxaparin is similar to heparin, means blood thinning medication. So it activates antithrombin 3. Antithrombin 3 binds to factor 10A and stops factor 10A from converting prothrombin to thrombin. So okay, enoxaparin means it's similar to heparin. So heparin binds to antithrombin 3. Antithrombin 3 binds to factor 10A. So antithrombin 3, they form a complex with factor 10A, and therefore factor 10A factor 10A can no longer convert prothrombin to thrombin, and due to its fewer number of molecules, low molecular weight heparins act primarily on factor 10A, not thrombin. So low molecular weight heparins act directly on factor 10A and not on thrombin. Okay. Aplastic anemia causes pancytopenia as a bone marrow replaces fat cells and bone marrow stroma. The absence of splenomegaly and peripheral examination is characteristic. So splenomegaly is not present. Splenomegaly is not present in peripheral peripheral examination. Bone marrow biopsy can be extremely useful in making the diagnosis, or there is a dry tap as well. So PRCA. What is PRCA? Is a rare form of marrow failure characterized by hypoplasia of. What is PRCA? Marrow pure red cell aplasia. So pure red cell aplasia. So there's aplasia, right? Or decrease in number of only red cells is a form of marrow failure. So this is from the marrow. So this is more marrow failure by severe hypoplasia of marrow erythroid elements in setting of normal GPO and TPO. So TPO and GPO. Okay, TPO, I think thrombopoietin, and TPO, thrombopoietin and granulocyte macrophage coronary stimulating factor, GM-CSF. So GPO means I think GPO refers to means granulocyte monocyte CSF, granulocyte macrophage coronary stimulating factor. Okay, so there is a normal level of GPO and TPO, but this red cell aplasia means red cells are not maturing or not forming. Hypoplasia because marrow precursor erythroid cells is a decrease in number. PRCA associated with thymoma. So thymoma occurs. So thymoma occurs, lymphocytic leukemia occurs, and parvovirus B19 infection also occurs. So pure red cell aplasia is associated with thymoma. So there is thymoma. Thymus gland now increases because red cells are not increasing, so something has to increase. So leukemia, WBCs increase, thymus, WBC increase, thymus increase in size, leading to thymoma, and parvovirus B19 infection also occurs.